Hello, welcome and kumusta? Thank you for joining me. This is Hal, your occupational therapist, and welcome to OT Conversations. In this episode, I'd like to talk to you about some of the things that niggles, some of the things that I find somehow interesting and at the same time a little bit annoying. There are a few things that I observe at work and some of the therapists' terminology or the processes, and I find it really interesting. Let me tell you one, or a few actually. So the first one would be this thing when people say you teach a person to skip when you're using crutches. So if you think about the act of skipping, it is so much different from when a person is really using a crutch. Because when you skip, what's going to happen? You're obviously using one leg, but you give it's almost like a jumping. You do a jump, there is a good toe off, and then you land from one place to another, or maybe at the same place. But the difference with skipping is that you land on the entire foot. So you got foot flat straight away. It is taking away that process of actual gait of heel strike. But when you're teaching somebody to do walking and using a crutch, there should be the process of gait, which will involve a heel off, toe off, heel strike, foot flat, heel off, toe off, and swing, that kind of thing. It should have that. So, guys, when you are using crutches, you are not teaching a person to skip because you're using the arms. You're teaching the person to glide. You are teaching the person to use those crutches to assist on the swing phase, and you are teaching a person to maintain that heel strike with the good leg that you're using. So here's one. Number one is you do not teach skipping when you are teaching a person to use a walking crutch or walking crutches, particularly a bilateral crutch. That's one of the things that zings in my head every time I hear a therapist says that they cannot skip. Of course, they shouldn't skip, and you shouldn't teach people to skip because that is wrong. So that's one. What's the other thing that annoys me? And it's something that you would observe every now and again. When people are teaching a person to move the limb or the legs or the arm, and during their therapy sessions, what a therapist would say would be this: push, 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 push. That is annoying, and at the same time, it is inefficient. And whoever started that process, isn't it? Because you hear this, I'm sure it is passed on from generations and generations of therapists. I guess as a coach, you would do that. Push, 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 push. But even when you're going to the gym, you don't go push, 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 push. That is so annoying. What's that? Is that a representation of a muscle firing, where the muscles are firing? Fire, 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 fire. Does it go like that? So stop that, guys. If you can just give an instruction to your patients and your clients, just say ready and push. Okay? When I say go, I need you to push as hard as you can. Ready and push. That's it. Just one push, one effort. When somebody is pregnant, you don't tell a woman giving birth to say, ready? Okay, when I say go, ready? Push, 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 push. You don't do that, guys. And it is really annoying. And I don't know what the origin of that is. So that's one thing that we should try and move away from. Push, 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 push. And it's there. It's like a cold that gets passed on from one therapist to another. And I'm sure students have learned this from their placement and they've seen that from somebody, and it's just not facilitating. Okay, that's one. That's the second one. The push, 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 push syndrome. Okay. The other thing that is a bit, again, possibly annoying and irritating from my end based on what I have been observing, when therapists are teaching a person to go back to the chair from the floor and they say that this is a backward chaining. That is wrong, guys. Backward chaining comes from the treatment and the principle, and the one that quoted this first is a behavioral approach. It is a learning approach and it's backward chaining. What does this mean? It means that to facilitate learning, the technique is to teach the person the last step of the task. For example, if you want to teach a child to do dressing, then you encourage them to participate. You get them to pull the socks first. That's the end part of it. Or if you have to put the socks on, put it on first and you let the child pull the socks at the last end. So when you're doing, that's backward chaining, because when you start from the end and the end part, there is a success straight away. And when a person achieves success, then learning gets facilitated. So if you're doing some dressing, you want to put the shirt on top of just over the head and you let the child pull so that the shirt would be drawn through the head. And that is backward chaining. Doesn't mean that when you're teaching a person to return from the floor back to the chair is backward chaining. That is wrong. Whoever quoted that is wrong. Okay? And you don't teach a person to do backward chaining by getting back to the chair. So you can quote it as functional mobility retraining from floor to chair. It's not a backward chaining. Only because they're going back to the chair, it's not a backward chaining. That is wrong. Okay? So don't use that. What other things that is quite irritating at work and at practice? Oh, I know. When, for example, a person is trying to stand up and initially a person will try, and there is a frame in front of them. All of a sudden, a person will try and reach for the frame. And just like a sentinel, just like a guard, a therapist would be quick to reprimand and tell the person off, tell their patients off. There are others that do it nicely, but there are others that is like a sentinel. They're like a police. That is so wrong. A natural tendency of a person when they stand up is to move their arms forward. Try that with children. Try that with anybody. The first tendency is for them to move their arms forward when they're sitting down. And why is that? That is because the body wants to have their center of gravity move away from the base of support. So when you have that, when your arms are forward, then it will dislodge the base of the center of gravity out of the base of support, which will facilitate the standing. And a person who feels weak when they're standing up, that's also their tendency. These are all compensatory methods that the person is employing themselves. So their tendency is at first to put their arms forward. That's an interesting behavior that you need to observe as clinician. What you need to do is find out whether the person can actually change it afterwards. So that's the first tendency. When they do and when they try and pull the frame forward, or they reach their arms and reach for the frame and they pull backwards, the frame will naturally tip back. And what you want to find out as clinician is actually you want to see if the person can adapt and can change their methods, thinking that process is ineffective. So you're actually checking problem solving skills of the person. So all I'm saying is, if you see a person do that, observe first and watch how they adapt to their inefficient movement. Do not straight away tell them, don't do that, and da 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 da, and then get back at the person and like a wolf or a hound onto the patient. So these are, your patients are people. They treat them with the same respect as with everybody else. They're not stupid. Give a little respect. So that's one way. So what have I talked about? Backward chaining, gliding, push, push, push. This one, when the arms go and reach forward onto the chair, that's the one thing. In relation to this reaching forward to pull, why is the person doing that? The person is doing that because of a compensatory strategy, because the legs are not strong enough. The other thing that they will do is they will actually then try to find out, see if they can figure out a way to stand. And what they will do is they will try and find perhaps the armrest or the armchair that they can push up. Again, people are pushing up. That is because they have weak legs. And that's a natural tendency for everybody. Everybody will push up to supplement the weakness on the legs. So it's an indication for any therapist that the leg is weak, and therefore those legs needed to be strengthened. Those legs needed to be restored in terms of movement. Okay, so that is people trying to push on the armrest as well. So it is better that if you give an instruction to your patients, you give them the task. Okay, in a simple way. Your objective, if it was me speaking to a person, good day, we're going to stand up. Your objective is to stand. Now, think about safety. Find out the best way on how you can stand up safely and with ease. So I understand that your legs are weak at the moment, but try and figure it out first, and then we'll find out together what can be done if there is a need to adjust your techniques, okay? So allow some kind of processing with that sit to stand, okay? That is the instruction number 4 regarding that pulling. The other thing, the yapping, the constant yap. What do I mean by this? For some strange reason, therapists probably think that we are doing or we're being better therapists if we give lots of verbal instructions. We love to hear our voice, probably, and there's a lot of instructions, so many yaps and instruction. And we need to minimize this, especially for those people with stroke who has a left side impairment or left brain impairment. Remember, left brain usually is the center for communication. And you give a lot of auditory stimulus or stimuli, and this confuses a person. Or it's just not coming in. It will just come in as a random noises, and it doesn't help. So again, for those people with the left-sided stroke, you may have to go visual on them and with very simple instructions. So if you're going to do some transfers from bed to chair, and if the person is already sitting down on the bed, you say, okay, your objective, you just point. You need to go from here to here. Think about safety. When you're ready, yeah, obviously there's going to be some frame in there, but you use visual cues, particularly for those people who has the left-sided or left brain CVA, right? You use the visual field. So that's one. Minimize the yapping. Imagine if there are two, this is something that I'm observing as well. If there are multiple therapists working with a patient, and if the patient cannot do it, and then the therapist is just giving constant information, constant instruction, and it's one after the other. Therapist one would go all the instructions, and if it didn't work, Another therapist would be quick to give extra instructions in there. Yeah, I've worked with a lot of patients in the past and currently, and I have. And that's the feedback that I'm getting. And some of what they're saying is that they're on to you like wolves, like pack of wolves. Just minimize the instruction. Okay? People, when they're moving, they need to concentrate. They need to plan their way around. And planning and listening and giving instructions intensely, so much instructions, is not helping. Right? Yeah, I guess those are the few things. Those are the very few niggles at work that I am observing that people just develop the habit of doing. And I'm sure they're probably not aware. You guys, you're probably doing it. You're probably not aware that you are. But I'm sure you pick this up somewhere and you can adjust it. You can adjust your practice so that you become a better clinician. I hope you enjoyed this episode, guys. Until next time, bye. If you enjoyed this podcast, talk to your friends and colleagues about it. Like it, subscribe, share, and do what you can to appease whatever algorithm that is at play. Just remember, guys, anything you do matters and has an outcome. Until next time, bye.